we did the wedding anyways. So we went back, and so it's a lot of things happening that could, even without any other thing, that could mess up with my emotions, and which in turn can affect my hormones.
Yes.
I already have an hormonal imbalance, then coupled with this life happening around this time. So it's like a lot going on in my body already.
Hello, 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 beautiful people. How are you all doing? Thanks for joining me again on Life Glow channel, and where we discuss everything women, women's wholeness, health, relationship, faith, and the like. Today I am very, very excited, super excited to have my guest on. She's a sister that I've known for God knows how long. you know, way back from Ilorin to Olivet Heights, and our paths have crossed once again. So I want to really thank you for coming. Thank you. I know that getting our schedules together was a little bit challenging, but thank you
Yeah.
for for staying true to it, and for coming. So um with joy in my heart, I want you to welcome Mrs. Rumke Ajayi. Thank you so much. So before we dive into the um, interview per se, and the discussion, I would give her some few minutes to just also introduce herself and what she wants us to know about her. So over to you.
Mhm. Yeah. Um, Good afternoon, everybody. My name is Ajayi Victoria Aderonke. I live in Sweden. Um, I'm a mom of four beautiful children. I'm married. By the grace of God, I work as educational guidance and counselor for youth. Yeah.
Wow.
So right now I work with in conjunction with the Ministry of Employment here in Sweden. So I particularly in my role, I give like Rod give me that's like advice and counseling to people who are unemployed,
Okay.
and I try and give them guidance towards the career path they chose.
Okay.
So basically, that's what I do today.
Wow. 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 Wow.
Uh,
That's good. So
and
how is Sweden? How's the weather
Sweden
like
is
in
good.
Sweden?
Sweden is fine. If I can describe Sweden, I always say it's like Ilori.
Wow. Wow. So
It's
that's not
full.
much change for you.
Peaceful could be boring sometimes, but at least it's very peaceful.
That's
And yeah, it's very very family oriented environment. So yeah,
wow.
and of course, and every other factors that comes with it.
Yeah.
When you think of Ilorin back then,
Yes. Yes.
then you can connect the dots.
Yes. Yes. All righty. Thank you so much for giving us a little bit of background to what you do,
Mhm.
where you live, and your family dynamics. Thank you so much. So let's dive into the discussion. Can
Mhm.
you tell us about yourself before marriage, before your infertility, and just walk us through the whole 9 year, of your womanhood before marriage, and then
Mm.
what transpired once you got married and you're
Along the
trying
line.
to,
Mm.
you know,
Yeah, I think I will start from puberty stage, and that I choose to start from there because that's the mark of womanhood.
okay,
And I should, if I recall, I didn't start menstruating until I was around 14 and a half, going to 15 years actually. So that's in so many people's calendar or calculation is falling to the late side.
yeah,
But yeah, it is what it is because I could remember I was in SS2. I was in SS2 first time. Yeah, SS2 first term. Yeah, and after the holidays, around December period, I I saw the I saw the first period, and it wasn't like I wasn't shocked because thank God I went to a boarding school, and by God's grace I've been able to learn from my peers and from every my seniors, everyone around me. So it wasn't something new to me, except that I wasn't at home when it happened. I was at my auntie's place,
Okay.
and I couldn't express myself to her like that. But I was able to get help
Mm.
from another cousin of mine, an older cousin. So it wasn't like I didn't care, but it was just like I found it a little bit like private, like, oh, this moment I prefer to share it with my mom.
Mm-hmm.
So I just try to keep it to myself till I go back home so that I could relive the moment with my mom. So it started there, and it was regular for a while. And throughout my secondary school days, it went like that, and it was regular all through
Okay.
up until when I finished, up until like 3 years after, like 18. I should be around 18 then. Then I started experiencing some irregularities.
Okay.
It could come and go for like months,
Wow.
like 6 months, like 4 months. Initially it was like 3 months, 4 months, 3 months, 4 months, 6 months. Then as I progressed in age, it became more. It ceases for more time gap
Okay.
in between. So it was concerning to me, and I spoke with my mom about it. Like, mommy, I don't know why I'm missing my period. And I said, oh, so far you don't go close to a man, then you are fine.
I know.
I
That's always the big concern. Then don't touch. Don't let anyone touch you. I'm kind.
exactly. So my mom, she was always like, once you don't get close to a man, then you are fine. No, I think it's normal. To her, she sees it as my mom was a very, very spiritual person, and she always feel like everything has to do with prayers and stuff. That so far I did not do any evil to anybody. So far this, so far that, there is nothing that will happen to you. It's normal. Sometimes it happens to me too. Sometimes, blah, blah, blah. And I'm like, oh, okay. But then I put it at the back of my mind, like, okay, stay away from men if you don't want to be involved. So because she's always telling me, oh, people with irregular periods, it could be very, very dangerous or very, very risky. If you go close to a man, you don't know when you are ovulating. You don't know when you are,
Now, which
this irregularity.
actually very true, especially if you're not having your period all the time.
Exactly, exactly.
Miscalculate your ovulation period,
Mm-hmm,
and
mm-hmm,
things
mm.
can happen.
So yeah, so she laid emphasis on that, like, oh, you just have to be careful. So I'm like, okay, I'm feel like a man, I could do whatever. So it went on and like that throughout my um I went to a college of education first and throughout my university. Then I completed my first degree in 2008, and something happened in 2008 actually that actually made me to raise the alarm. I mean, that caused me to like took it serious. And that was, I had an issue of blood. After, like, I've had my usual long period of not having my period, and then it later came. And when it came, it was so much. I was bleeding, like, I couldn't, I wouldn't say I was menstruating, I was bleeding. I took it like, okay, maybe the first 4 days, the normal 4, 5 days, it will go, but then it continued for like almost 2 weeks. So around then, I had to go. I was getting tired and weak and stuff like that. So I remember I was in Lagos. So I came back to Ibadan. I spoke with my auntie. So thank God she had a friend and a neighbor then that was the nurse. She works at Adioye Hospital at Ibadan. So I spoke with her. I said this, and she was like, "Hey, did you did you abort?" I'm like, Is someone that gets pregnant and abort? I don't. It's not." I was like, how could that be? Blah, blah. So she prescribed an injection for me. Like, okay, go and buy this injection. You take it for 3 days, and when it stops, I advise you to go and see like a gynecologist first. Go and take a scan, do a scan, and let's know exactly what is happening. Then I can refer you to a gynecologist afterwards. So I took the injection the first day, the second day didn't even look like it was going to stop. It was still clear, fresh, and just coming. And the woman was like,
Because after
"Are
2 weeks,
you sure?" After 2 weeks, so the woman was like, "Are you sure you did not?" I said, "If I do something, do you think I will come to you? I will want to hide it, right? So
right?
definitely you won't be the person I will come to, because I know if you know, my auntie will know. If my auntie knows, my mommy will know. So if I did anything, definitely you won't be the first person I will run to. I would rather run to the hospital
Yeah.
in a remote place, just secretly and do my thing." So she said, "Okay, I believe you, but at the same time, this issue is a little bit conflicting for me, because in my experience as a nurse, this is quite a little bit off, especially if you insist that you did not do anything." I said, "I swear I was busy swearing, cursing, and I did." So she said, "Okay, let's do. Tomorrow you take the last injection and we see how it goes." So thankfully, I took the last injection, and it went just like a normal period, and it went like that. So a day or two after, I went to take a scan examination, and I went there, and the man, I still have the picture, the scan. I still have it with me. I kept it in my Bible since. So when I got to the
Yeah,
doctor,
don't give the full story.
exactly.
The question that I was about to ask you, which you have
Mhm.
already gotten into, is at what point did you know that something was wrong? Which is what
Yes,
you're telling us right now. So,
yes. Mm.
what was, and I want you to continue a little bit before we stop, and then we'll
Mm.
get to the next question.
Okay, okay. So when I got the scan, the gynecologist looked at me and he said, "Well, there's nothing wrong with you, except that whenever you are ready to start a family, you will need help." And I'm like, "What does that supposed to mean?" He's like, "Because you have polycystic ovarian syndrome, that and it's not like you don't have enough
That's
ovaries."
US, right?
Yes, PCOS. So like it's not like you have a lot of ovaries in you, that the number of follicles you have is more than the average woman, but none of them can ever fertilize because they are encapsulated with cysts. So I'm like, okay. I took the film, the picture, and I left. And when I got home, I told the nurse, because me being naive, and I still wasn't really understanding that. So I wanted her to explain more. So she told me, she said, well, I think it's better for you to marry early, to start early, to do this early. And I'm like, early, 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 okay. I'll see. I'm not going to marry myself anyway, but we'll see how it goes. So with faith, I took that picture and I kept it in my Bible. And I said, "God, as you live, this is the doctor's report, but I believe in your report. So because of this, I'm entrusting this
Mm.
into your hands." So I put it in my Bible, and the Bible is as old as anything, but I left it there till today. The Bible is still there. I've bought a lot of Bibles after then, but that particular Bible, I refuse to let it go.
Before we continue, thank you so much for really emphasizing on that. I say
Mm,
so much on this channel. Whether you're Christian, you're Muslim, whatever God you serve, You have to have a personal relationship with that God, and that
mm,
better with yours. Because I feel that in life, there are journeys, there are challenges that you go through.
mm,
You will get to a point that you have to sit down and say,
mm,
Coach, let's have a discussion.
mm,
And there is even right there in the Bible. It says, bring your case. Let's have
mm.
I can't
Come, let's have a
you know,
discussion.
let's have a discussion. You understand? So you will get to a point that you will have to exercise your faith. And Bible says that those who know their God,
Mm,
you understand? Your mom
absolutely.
wasn't there, your aunt wasn't there. You went to the hospital, they gave you a report that you believe that is the doctor's report. And what did you do? As a young lady, you went, put it in your Bible, and you told God, this is the report of the doctors.
Mm-hmm.
Whether it's true or not, that is what they have given me. But I
Mm-hmm.
choose to believe in your own report. That's
Mm-hmm.
powerful. That is really, really powerful. And that's not, you not doing what is necessary to do.
Mm-mm.
And as we will continue, and as as our audience will listen to you, you still
Mm.
went for your medical checkup, you still went for everything that you needed to do.
Mhm.
But
Mhm.
as you were doing it, the key was you had entrusted the whole situation, you had entrusted it to the hands of God. And that is so powerful. That is so powerful. So
Mm.
I guess my next question to that will be, what was the most unexpected challenge that you faced in this journey? Because I know that there are so many. I've had your story, you and I we've discussed before, I've had it. So I know that there are so many unexpected turns on your story.
Mhm. Mhm.
I wanted you to come on because I believe that your story will change life. Your story will give hope to
Mm.
someone out there. So let us,
Mm.
what was the most unexpected challenge you faced in the early stage of this journey?
Actually, what I wouldn't say I have a challenge per se, and the reason is because I was carefree.
Okay.
When you are ignorant of something, you behave nonchalantly towards it. I was so nonchalant, like it doesn't bother me.
Okay.
As a matter of fact, when I see it, sometimes when I luckily have my period, I was usually a little bit angry because I didn't know how to use my sanitary tools properly. There is no how I'm going to use it that I will not get stained, no matter how hard I try.
Mm.
I used all the same pool always, so all brands. There is no way I'm going to use and I'm not going to get them because I was so nonchalant about it. So when it comes, it's always like oh, like a burden to me. I was so careful, and I don't have pains.
Okay.
I don't, okay, let me say, I don't usually have pains. Sometimes I do, maybe just a little, inflammation of the pelvic or something, just a little pain around my bowel or something, but nothing really serious. So I wouldn't really say I encounter much challenge. And God so good, we live maybe because we grew up in a city, a Muslim city. There are things that are sacred to us as girls, and there are things that are very private to us. We are very private. If if I'm correct, depending on which area of Ilorin you stay, you discover that you automatically you become an introvert. Even if you are not, somehow
Very,
the
very
environment makes it, yeah,
conservative kind of.
yeah, yes. The environment makes you
Not like
kind of conversate.
Lagos bubbling, Ibadan
Exactly,
bubbling. It's
exactly.
more conservative.
Yeah. So I think that helped me a lot because I wasn't talking about it with anybody because I wasn't ready to entertain any unnecessary fear. So yeah. So I would say because of that I can't really say there is any challenge per
Okay,
se,
so
except in the aspect of not knowing how to
and
when it comes unexpectedly or not knowing how to take care of myself properly and stuff like that. Mm.
all right. So before we proceed, I just want to say put a caution. I don't want any young girl listening to us today to feel that they shouldn't be talking to anybody
Yeah, yes.
because the generation that we lived in
Mm-mm.
is quite
You
different
have to speak out.
from what is happening right now.
Yeah.
And you did not speak out, like you said. Part of you not speaking out is ignorance. Not because
Mm-mm.
you had known better, you will have.
Mm-mm. Absolutely.
One
Absolutely.
of the things that Life Bloom is campaigning about is speaking up.
Yes.
Speaking. That's
Communication.
one of the reasons why we're creating this awareness. That's one of the reasons why we're coming on to share our story
Mm.
because we
Mm.
want people to learn. So if you're any young lady, young girl child out there, you're having pain, you're having unnecessary bleeding, or you're having a long bleeding period, more
Bleeding.
than a week,
And every bleeding.
heavy bleeding, you're having pain, your periods are not regular. They come this month, they don't come next month, they come maybe like after 3 months or something. You need to speak up. You need to
Yes.
speak up. You need to get
Please
help
do.
because that is the only way whatever is going on in your body can actually be fixed.
Advice. Mm.
Can actually be fixed. Is when you speak up, you know, and you go for medical checkup, they'll be able
Mm.
to say, okay, this are what is wrong, and
Mm.
these are what needs to be done.
Mm.
And we're evolving. The world is evolving. Health education is evolving.
Mm.
Medicine is evolving. So
Mm.
the challenges that somebody
Mm.
like you and I had growing up, you understand, is it
Mm.
might still be
Mm.
there,
Mm.
but it's not
Mm.
as major as it is right now because now there is
Mm.
internet all over the place. You understand? A lot of people even
Mm.
diagnose themselves before they go see the doctor. So from it, people go online, they go
Mhm.
to Google, and they go diagnose
You
themselves.
need a lot of things. Mhm.
And everything. Which that on its own is another issue. You shouldn't be
Mhm.
diagnosing yourself, but you can
Mhm.
and say, okay, I've not been seeing my period. It's not been regular. What
Mhm.
can be going on? Just to have an
Mhm.
idea, so that when you go see the doctor, you can know how to present yourself. You can know
Mhm.
what place you're going to give and
Mhm.
everything. So
Mhm.
I say all that to say that we encourage people to speak up, whether you
Mhm.
are young or you are old. Please
Yes. Speak up. Yes.
is the key.
Mm.
All right. So
And I'm sorry if I could add a little something.
yeah,
Also, we that are parents now, or adults, aunties, adults, please, when these kids come up to you, um, I know it wasn't intentional for my mom to not take it serious.
yeah,
I think that nonchalant attitude of mine was actually as a result of our own attitude as well. Because when I told her, she was like, it's nothing. You don't have to worry about it.
yeah.
Yes,
She didn't know better as well. So
yes, yes. So be informed. Adults out there, please be informed. And whatever sign your kids brings to you, please take it.
Serious.
Don't take it lightly. At least take it seriously.
Yeah. So I think the next question would be, how did this then? So the nurse told you that you have to get married early, da 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 da, and all that, and then the doctor had even already told you that even if you get married, you're going to need help conceiving, and
Mhm,
all that. So walk
mhm.
us through what then happened. Did you listen to the nurse's advice to get married early? You get married, and then once you get married, did you actually needed help to start having children? Because now you have four lovely kids
Mm,
that
mm.
by God's grace.
Yes.
So walk us through, and in between are probably breaking and chipping one or two things.
Mm. Okay, thank you. Yes, I was advised, oh, you have to marry early so you can start early because the more you advance in age, the more difficult it's going to be, blah, 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 blah. And for me, I was like, well, there's nothing about being early in my own this thing. At the time, I just finished my SSC. My parents were, there are other life challenges that were coming up little by little. So that was actually the least of my on my list then. Like whatever. Like I just have to say to myself first. I
Mhm.
just finished school. I'm just going into NYSC, and after NYSC, I still need to find a job and things like that. So it wasn't really one of my top of my list. And besides, I didn't have a relationship then. So obviously, every pointer was not actually pointing to marriage at that particular time. And at this time, when my nurse was saying this, I was already 25. So what what do you mean? I mean, what could early mean?
Mm.
What age would be early at that moment anymore? So
I
to
know.
me, I'm like, I don't know what your early, your definition of early is, but all I know is all I know is it's not going to happen anytime soon. So to the glory of God, I went through my NYSC without anything. um, Life happens. I lost my dad. My mom was sick, and everything. So marriage wasn't really anything on my top list. But I met my husband online, actually on Facebook.
Oh wow, wow,
Through
interesting. This is not. Please,
another story on its own.
so let's pack that one, because if we dive into that one, we will not leave. All right.
Exactly. So yeah. So he was a friend of a childhood friend. So yeah. So we met, and it was a long distance courtship. So it gave me time to like be on myself and work on myself and stuff like that. And it gives me time to be. It gives me the opportunity to focus on what is more important in the relationship, like being vulnerable and um, sharing the truth. I
Mm.
call it the truth because it's a lot of things happening. So it's like we haven't met, we haven't seen each other. So if it's not going to work with you, we can easily say bye bye, and that will be it.
Ah,
But so yeah, so because of that, for me, I was able to communicate freely and talk about almost everything
wow.
to him.
I'm
So
knowing
yeah,
everything
so
and still say, you know what,
ex-
you are still
exactly.
kudos to you.
Exactly.
Yeah,
So I
sometimes we say, you know what, I don't want to sign up for this. You, another
exactly,
topic entirely. I don't even want to go
exactly,
into. Wow.
exactly.
So,
So yeah, so it happened. He came home in 2010, and even then I was actually trying to let him know, like, maybe you shouldn't come because my mom was diagnosed with cancer at the moment, and it was already getting so serious. So I'm like, maybe you should wait. But he already bought his ticket. He came. We did the wedding anyways. So he went back, and my mom died. So it's a lot of things happening that could even without any other thing that will mess up with my emotions, and which in turn can affect my hormones.
There, we're going there.
Yeah,
We're going.
I already have an hormonal imbalance, then coupled with this life happening around this time. So it's like a lot going on in my body already. So but having discussed that with him, he's like, "Oh, you don't need that. You don't need to treat yourself. When you come here, then you can see a doctor." But for me, at the moment, I just felt like I don't want to risk it because yes, he seems understanding and everything right now. But if I eventually come there and there is no solution, this friendship is going to fade away and it's going to be a waste of time, energy, money, and stuff like that. So I went to an hospital in a company's hospital, and I was prescribed a medication that could bring my that could make me to see my period,
Right.
Primolut N. So I took it, and I was so bloated. I was as big as. But at the end of the day, I actually had the period. It came, and it was regular for like 2 to 3 months, and after then it stopped. Then he said, you know what, stop taking anything, like just stop. When you come, then we see how it goes.
Mm.
So that was how I penned the idea of getting help in Nigeria. So coming to Sweden, it's because that was the only problem I could identify at the moment. Coming to Sweden, I wasn't, yes, I was concerned about um, getting a job, progressing in my career, and things like that. But at the same time, what was number one on my priority list was how to start a family. So,
And
and it wasn't
then,
and it wasn't forthcoming. And if anyone is used to the Swedish system, you go to the hospital and you're going to be on the queue till they are ready to attend to you, basically. So I was getting impatient, but eventually I was able to get help at the hospital, and I was like, oh yeah, that's true. You have PCOS, and all you need to do is get stimulation. So this year I was almost like that was like 2 years into the marriage.
okay, 2 years into the marriage.
Yeah, 2 years into the yeah, almost 3 years into the marriage. So I was advised to maybe you need stimulation. If you stimulate, definitely, because there is nothing wrong with your ovaries, da da da. But without stimulation, you can't conceive. So I had to start the process, and the process again had to be carried out in the central hospital, not the district hospital. But the doctor at the district hospital was like, it's a simple procedure. I think I can help here. It doesn't, I don't think you don't really need any laboratory work or something. I think it's just medication. So she went ahead and prescribed gonadotropin shots, and she gave me the bare minimum uh, dose. And I took that for the first few days, went for the blood work and do the ultrasound, and nothing was working. Oh, I was so frustrated. And when I got home, I googled the medication, and I looked at the dosage, and I found out that the dosage in I actually went to a US website.
Mm.
So I could read on the US website that the dosage they recommend there was way higher than what my
Give.
doctor gave to me here. So on my own, I increased the dosage like times. Only God knows how
What?
many.
What was
So I'm going to mention here to everybody, my audience.
frustration can do?
Yes,
That out of frustration, you did that out of, you know what,
desperation.
desperation. Hey,
So please, everyone, don't let this issue. I know as serious and as emotionally draining, physically draining as it might be, please don't get to a desperate mode. Desperacy can kill like this. So I took it for the remaining days I was supposed to take the injection, and I went for the blood work. And
so like
in fact, by the
how did you increase it? How, by how many? So give us an idea. So let's say the doctor gave you like,
let's say the doctor was giving, maybe I was told to be taking 1 mg, for instance. I think I increased it like 15 or so. That was a lot. That was a lot because I read it on the website.
my sister.
The Yeah, I read it on the website. So it's funny. I give God the glory that I could sit here and relay my story actually, because at the moment I thought I was going to die. Uh, so before the appointed day that I was supposed to
And
go to
you did this
go
without
back,
your husband knowing, Abby.
I mentioned it to him, but he was just like he told, because of course he goes to work, so to him he's just like, don't do it. I trust you. You can't do that. He wasn't. He never thought I would do such a thing. He was just like, don't do it. Just you can. I didn't trust you. You can't do it. So to him, so when I was doing it, when I started increasing it, I didn't carry him along. I was just taking it like I was taking the regular dose. So before the set date that I was supposed to go for the checkup, I had a crisis. I had my tummy was like stone, like it was like there's a rock in my tummy.
Hmm.
So I was rushed to the hospital. The ambulance was called. I went to the hospital. I got there. The emergency, they did their pregnancy test and it came back positive. But the nurse came and was like, the level of estrogen in your blood is so high that we don't know what exactly is going on in your body. That we have to transfer you down to the teaching hospital. So I got there, they did the scan and everything, and the doctor said, we don't even know how many babies you have in your tummy right now.
No, but Paris.
That they cannot categorically say how many babies you have in your tummy. That you are overstimulated. You are so stimulated that we can't tell. We cannot tell. That we just have to wait for a few more days for the fertilization to complete before we can do another scan to see exactly what is going on in there. I could not move. Like I was like a vegetable on the bed. I could not move my body at all. I was so heavy. So, and I was living on pain reliever then. So, few days after, I went back to the hospital, and they did the test, the scan, and they found that, oh, you have 4 fertilized ovaries. Then they don't know how many developed eggs surrounding there.
Hmm.
That the sac in my tummy, that they can't even count, is a lot. That this is high risk. That they can, but I have to decide if I want to go along or I want to terminate. And I'm like, terminate what? I'm not going to terminate it. I know I'm not going to be fine, but I'm going to keep it. So the nurse said, if you keep this pregnancy, you can't do anything until these babies come out. You can't walk, even you can't stand up from your bed to your bathroom. That is how bad it's going to be as time goes on. And this is not a very long time goes on. It's going to be in a few weeks' time. She said in a few weeks' time, not like in a few months' time, in a few weeks' time, because all these cysts that the babies will be growing and they are going to be pushing the cyst. The cyst is going to be pushing them. It's like it's going to be a struggle
Struggle
in there.
imagine
Yeah.
4 weeks.
So
Hey,
yes. So you have to decide how you want to move forward with this. Then I said, oh, I'm going to do it. And I was, by 19 weeks, I was already getting weak. By 20 weeks, I, one of the sac broke, and going to like 21 weeks, I went in for checkup, and they found out that one of the ovaries, the water broke and the baby is dead. So the doctor was like, that at this stage it's too late to do cyclage for you.
hmm,
We can't do anything about that, but we have to see if you are open or not. So we checked and they were like, oh, you are a little bit open. Maybe we will have to put you on bed.
when you say open, you mean dilating.
Yes, that we have to put you on bed and see if we can make you close back a little bit before going home. Or probably you are going to be here for the rest of the pregnancy. And I'm like, at 21 weeks, at just 21 weeks.
When you
So I was there, and in the course of admission, they took my blood so they could do some blood work and stuff like that. And they came back, and the doctor said it's not looking good. Infection has set in. So I'm like, okay, infection, okay. Can you treat the infection? And they said no, they have to end the pregnancy. That the pregnancy have to end. If we choose to save you, I mean, if we are going to save you, then this pregnancy have to go, because we don't know if the infection is going to how aggressively we are going to treat this infection. And if we go ahead and treat this infection, the we are going to be on heavy antibiotics that could have negative effect on the ovaries, on the babies, and they could come out deformed. They could come out not useful. That is going to be that it was going to be like
men
a
go through,
waste of.
what women go through.
So they were
We have,
like,
literally, we have once a year Mother's Day, but what
ooh.
women go through.
So they said, no, you are going to bring me. We just have to hand it, because if you keep you and decide to treat the infection, you might end up we might end up losing my enemy, and the babies might not even be they might not have a good quality of life. So just let them go. Oh my goodness, I have all the documentation to prove this. I took the pictures, we buried them. They came out one by one, and I was induced. So they came out, and that was when they started treating the infection. I stayed in the hospital. Only God knows how many days or weeks or something. But at the end of the day, I thank God that I came out of that experience alive, because I had to cut it as short as possible so as to fit in the program. But it was not as easy as I
As you have
am
narrated the
expecting it
story,
to be
it's,
now.
it's
It
never
was
easy when you are telling the story because
it was it
what?
was yeah, it was in between life and death kind of situation. And yeah, it brought a lot of emotional.
Wow.
it
So
was it was a, it was a trauma. It
yeah,
was a trauma.
that's where I'm going next. I'm going
Mm.
there next to say endometriosis, PCOS, fibroid, infertility, there's such a silent struggle. And I don't know, there's silent struggle, and I don't know how and how long it's going to take us from breaking from this being silent struggle. A lot of women, for endometriosis, which is what I experienced, a lot of women are going through endometriosis. 1 out of every 10 women have endometriosis. About 200 million women worldwide have endometriosis. Same with PCOS. You know, if you see 5 women, the likelihood that 1 or 2 PCOS or fibroid is very high.
Very high. Very high.
Very high. And we're not talking about
it enough.
Talk about it. And that's why, I felt the burden to come out and share my story, and just let people know that you're not alone. And the earlier we begin to speak about this thing, the earlier we begin to share our experience, and what the knowledge we have gathered over the years, the better. Even in churches, we go to church to pray, to do this, but how many people, women in those churches, have endometriosis, infertility,